As the number of confirmed cases in the United States continues to climb, senior living facilities are planning how to protect their most vulnerable residents.
Yeah, WLWT News 5's Jatera McGee live for us tonight with the worry when it comes to the worst case scenario. Jatera?
Well, Mike and Cherie, the facility we talked to has already stopped outside trips for residents, like shopping trips. They've also told family members if they've recently traveled or are having symptoms, just don't visit at all.
I just think it's best to be prepared.
The proactive approach to keep our seniors safe if and when coronavirus hits greater Cincinnati.
I don't think people were as worried a week or two ago as they are starting to get more worried now.
Debbie Kirshner runs Spring Hills Middletown Assisted Living, home to about 75 people who fall among the most vulnerable age group.
While if we were to get the coronavirus, we would get sick, but if our residents get the coronavirus, it's likely that they would die.
Case in point, residents at the Life Care Center nursing home near Seattle, Washington, now in quarantine after several residents and a staff member tested positive. At least 5 infected patients have now died. Dozens others are showing symptoms.
It's heartbreaking just to hear those stories because we care for so many and they're just like our families.
In Ohio, state health officials say they're bracing for the inevitable, emphasizing today preparation over panic.
My job is to provide a lot of education to staff, to the residents, and to their families.
Along with stressing hand washing, Elizabeth Kettler says they've ordered extra hand sanitizer, personal protective equipment, and cleaning supplies.
We've made sure the chemicals that we're using match up with what the CDC recommend.
They're closely monitoring patients and staff.
We're letting staff know if they're having any of the symptoms, which is the fever, cough, shortness of breath, not to come into work.
Now, if a resident at the facility comes down with coronavirus, there is a plan in place. They would immediately contact the health department. Residents would have to stay in their individual apartments, and the facility would set up stations outside each one of them for staff to change in and out of protective equipment. Jatera McGee, WLWT.